Thank you for your interest in the Horizon Europe Health Cluster. This is a presentation of Destination 1, Staying Healthy in a Rapidly Changing Society. Please note that it is only the text of the work program that has legal value, and that the oral presentation is only advisory. Strategic planning in Horizon Europe has resulted in a strategic plan for the first 4 years of the program. This set out the key strategic orientations and expected impacts, which are further developed in the destination text at cluster level in the work program. Under Horizon Europe, there is increased emphasis on expected outcomes and impacts. While outputs are the direct results of the research, outcomes that are described at the level of the topic refer to the immediate use of the results and also specifies who the users are. Impacts, on the other hand, are described in the destination text and refer to the wider benefits for society. It is very important to consider these when preparing your proposals. In case you have been involved in previous calls, you should pay particular attention to outcomes, which have only been introduced in this program. The overall aging population is expected to put increasing pressure on our health systems. Helping people to stay healthy for a longer time through prevention of diseases and promotion of healthy environments and lifestyles will be an essential element in the response to this situation. At the same time, there has been a long underinvestment in the areas of disease prevention and health promotion. This is why the overall objective of this destination focuses on preventing diseases from developing in the first place. It is expected that this work program, together with the coming ones over the next years, will together make up a comprehensive response to this challenge. More specifically, as people's health can be impacted by a rapidly changing society, it becomes increasingly challenging to keep pace and find our way through new technological tools and societal changes, which both are increasing pressure on the individual's resilience. In order to ensure no one is left behind, to reduce health inequalities, and to support healthy and active lives for all, it is crucial to provide suitable and tailor-made solutions, including for people with specific needs. Research under this destination will thus enable citizens to live longer and in better health, as well as reduce health inequalities thanks to improved health promotion and disease prevention actions, targeting several of the most striking aspects of changing societies. Ensuring a healthy life starts already in early childhood. This is why across all stages of life, from birth, infancy, childhood, adolescence, pregnancy, mature and late adulthood, and in all health conditions and needs, citizens will have access to tailored health solutions, including solutions to help achieve and maintain healthier behaviors and lifestyles, as well as well-being. Dialogue and consultation between stakeholders and policymakers will be instrumental for success. Likewise, integration of care and coordination among different settings, from community to healthcare, will be key. Specific measures will also be developed to educate and empower citizens throughout their life to play an active role in their health, self-management, and self-care to the benefit of an active and healthy aging. For Destination 1, these constitute the overall expected impacts as described in the introductory part of the destination text. In the interest of time, this will not be covered further. Your proposals should set out a credible pathway to contributing to staying healthy in a rapidly changing society, and more specifically to achieve one of the several impacts listed. Thus, depending on the scope of your proposals, we expect your proposal will not only address all the impacts, but only some of them. Destination 1 has 4 topics in the work program for the year 2022. They are all research and innovation actions, and 3 of them are 2-stage topics. The first one is entitled Boosting Mental Health in Europe in times of change and has a total budget of 50 million euros, and the expected EU contribution per proposal is 7 million euros. The second topic has a title, Trustworthy AI Tools to Predict the Risk of Chronic Non-Communicable Diseases or their progression. 60 million euros have been made available for this topic, and the expected EU contribution per proposal is 6 million euros. The third two-stage topic is about prevention of obesity throughout the life course, and here the total budget is 60 million euros with an expected budget per project of around 10 million euros. The fourth and last topic for 2022 is single stage and has the title Personalized Blueprint of Chronic Inflammation in Health to Disease Transition, with a total budget of 50 million euros and expected project size of 7 million euros. The impact on mental health by a transforming society and environment is accelerating in Europe. In particular, climate change, digitalization, and not the least the ongoing COVID-19 pandemic exacerbate the massive impact on mental health. There is an unmet need for evidence-based strategies and interventions to promote mental health and manage mental illness. This has motivated the development of the first of our topics, boosting mental health in Europe in times of change. Proposals to be funded under this topic should aim to deliver results that contribute to one or several of the expected outcomes listed on the slide. And as you can see here, outcomes specify the user of the results at the level of each topic. Healthcare professionals, national or regional public authorities, and other relevant actors in key settings, such as schools or workplaces, get comprehensive strategies and interventions for the promotion of mental health and the prevention of mental ill health, targeting the most vulnerable populations. They adopt approaches to mitigate the mental health burden and help cope with the combined effects of a transforming Europe. The COVID-19 pandemic, climate change, environmental degradation, energy transition, demographic and migration factors, digitalization, and exponential technological advancements. The scientific community, together with the public authorities, anticipate new and emerging risks to the mental health. And citizens get new tools and services to take informed decisions about their well-being and mental health care needs, including for self-management and self-care. Citizens feel less stigmatized and marginalized due to their mental ill health. The scope of this topic comprises developing a comprehensive knowledge base of how a transforming Europe can influence mental health in a fast-evolving society, especially in the most vulnerable populations. It also has the ambition to develop and implement interventions which promote well-being and prevent mental illness to help cope with and mitigate the stress of a changing society. The interventions should target relevant settings such as workplaces, schools, and the most vulnerable populations such as children and adolescents, the elderly, people with pre-existing health conditions, and socioeconomic high-risk groups. Research should be multidisciplinary, including medical sciences, social sciences, the humanities, and the arts, if relevant. It is important to consider aspects such as associated behavioral patterns, stigma, and novel social dynamics, as well as different socioeconomic, cultural, and geographical contexts. Proposals should involve end users, including civil society organizations, and strategic partners in the design and during the course of the project. All data should be disaggregated by sex, age, and other relevant variables. International collaboration is encouraged. Finally, all projects funded under this topic are strongly encouraged to participate in networking and joint activities to be established in the context of the grant agreement preparation, and proposals should therefore foresee a budget for such joint activities. Let's now look at the second topic entitled trustworthy artificial intelligence tools to predict the risk of chronic non-communicable disease and/or their progression. It is widely recognized that health systems must put more emphasis on prevention and adopt a person-centered approach. Artificial intelligence, along with the increased availability of health data, hold great potential to pave the way for personalized prevention and enable progress towards risk prediction and early detection of chronic non-communicable diseases. This topic will support multidisciplinary research, build on broad stakeholder engagement, and support proposals developing novel, robust, and trustworthy AI tools to enable timely personalized prevention approaches for chronic non-communicable diseases or disorders. The topic does not exclude any diseases or disorders. Proposals to be funded under this topic should aim to deliver results that contribute to all of the expected outcomes listed on this slide. Those are clinicians, medical professionals, and citizens have access to and use validated AI tools for disease risk assessment. Hence, citizens are better informed for managing their own health. Healthcare professionals utilize robust, trustworthy, and privacy-preserving AI tools that help them to assess and predict the risk for or progression of chronic non-communicable diseases. Hence, citizens benefit from improved health outcomes. Healthcare professionals develop evidence-based recommendations and guidelines for the implementation of AI-based personalized prevention strategies. Citizens benefit from optimized healthcare measures superior to the standard of care. Healthcare professionals employ quantitative indicators in order to identify and follow up on individuals with high risk for the development or risk for the progression of chronic non-communicable diseases. Proposals under this topic are expected to develop and test AI tools for assessing and predicting the risk of developing a disease or the risk of disease progression once it is diagnosed, taking into account the individual's group, genotypes, phenotypes, lifestyle, occupational or environmental stresses, and/or socioeconomic and behavioral characteristics. The AI tools may include a broad range of technological solutions on their own or in combination with other relevant state-of-the-art technologies, such as AI algorithms, mobile apps or sensors, robotics, e-health tools, or telemedicine. Proposals should implement proof-of-concept studies to test and validate the performance of their AI tools in the real-world setting and compare their performance to the established practice. The applicants should ensure that the AI tools developed are driven by relevant end users' needs. Therefore, the proposals are expected to introduce concrete measures for the involvement of end users throughout the AI development process and not only in the last phases of development. Actions should promote the highest standards of transparency and openness of the AI tool. Finally, all projects funded under this topic are strongly encouraged to participate in networking and joint activities to be established in the context of the grant agreement preparation, and proposals should therefore foresee a budget for such joint activities. The next topic addresses the growing problem of obesity at all ages in our society. Although health in general has improved in Europe over the last decades, the prevalence of obesity has tripled in many countries. It is known that once individuals become overweight or obese, they are at risk of developing a number of chronic diseases. This includes diabetes, cardiovascular diseases, or cancer. Overweight and obesity are largely preventable. In the current pandemic, the issue of overweight and obesity has become even more prominent, highlighting the need for prevention of overweight and obesity. The topic aims to address a number of bottlenecks in our current understanding of obesity and strengthen our arsenal of intervention strategies. Proposals to be funded under this topic should aim to deliver results that contribute to some of the expected outcomes listed on this slide. Those are researchers, developers of medical interventions, and healthcare professionals have a much better understanding of basic biology pathways, genetic and epigenetic blueprints, conferring susceptibility to and protection against overweight and obesity. Healthcare professionals, national, regional, local public authorities, and other relevant actors get improved tools to fight obesity throughout the life course. They also get access to economic and cost data related to obesity and its prevention, and they implement tailor-made prevention campaigns. Citizens get new tools and services to make informed decisions about their lifestyle choices that will prevent them from becoming overweight. We expect the proposals under this topic to address several, but not all, of this long list of expected elements. For instance, an improved understanding of basic biological processes behind uncontrolled weight gain, identification of socioeconomic and lifestyle factors, identification of pre-obesity biomarkers, but also conduct meta-reviews of available science addressing the combined causal links between different lifestyle factors, and also addressing the mental health aspects of obesity stigma, as well as aspects of inequalities. It is expected that proposals have a patient-centered approach. Finally, all projects funded on this topic are strongly encouraged to participate in networking and joint activities to be established in the context of the grant agreement preparation, and proposals should therefore foresee a budget for such joint activities. A large body of clinical evidence has accumulated over the past decade, demonstrating that chronic inflammation is a process implicated in chronic diseases and disorders. Inflammatory response is a physiological process helping the body to heal against harmful entities, but when dysregulated, it could lead to unresolved chronic, local, or systemic inflammation. The latter, in combination with the person's genotype, phenotype, medical history, nutritional and well-being status, lifestyle, or occupational or life stressors, is likely to be involved in driving the health to disease transition, leading to the onset of chronic diseases. The aim in this last topic of chronic inflammation is to specifically elucidate the trigger point between health and disease in chronic inflammation. What are the chronic inflammation factors responsible for this transition, and how can we better manage this process to avoid or delay the transition into chronic disease? Proposals should be of multidisciplinary nature, involving all relevant stakeholders, and may cover several different stages in the continuum of the innovation path, from translational research to validation of the findings in human studies. Proposals are expected to develop and implement data-driven, personalized approaches to identify the drivers of chronic inflammation that may determine the transition from health to pre-symptomatic and early stages of chronic diseases and disorders. Proposals may develop innovative technologies and set up proof-of-concept studies as well as run test interventions. The topic does not exclude any disorders or diseases. Like for other topics in this destination, projects funded under this topic are strongly encouraged to participate in networking and joint activities to be established in the context of the grant agreement preparation, and proposals should therefore foresee a budget for such joint activities. We look forward to replying to any questions you might have during the session. You may also reach out to your national contact point for the health cluster. We thank you for your attention and wish you success in the preparation of your proposal.